these things. So hello, everyone, and thank you for joining us. I'm Shelley Dallas Smith, the Finding Balance Project Coordinator from the Injury Prevention Center, and I will be your host today, along with Marla Zubiak, our admin assistant for our tech support. And Marla will be um, entering things in the chat box and that kind of thing for us. So we are pleased to have such a good turnout today on this topic of building confidence and safety, cognitive behavioral strategies for managing concerns about falling with our speakers, Candy Radaba and Rachel Uniat. And on behalf of the Injury Prevention Center, we respectfully acknowledge the traditional First Nations territories of Treaties 4, 5, 6, 7, and 8. We also want to acknowledge the Métis and Inuit people who share a deep history and connection with this land. We make this acknowledgement as an act of reconciliation and gratitude to those whose territory we reside on and whose histories, languages, and culture continues to influence how we live, work, and recreate as visitors on this land. So please take a moment and acknowledge the lands that you reside on as well today. All right, so as we said, the webinar will be recorded and your on the screen says your microphone will be muted and your cameras will be disabled for the entire webinar. So through the chat function, you will be able to ask um, any questions that you might have, technical questions in particular with the chat functions, and we'll be posting some general links and information through the chat function as well. After the presentation, there will be some time for questions, so please use the Q&A function for all your questions as opposed to the chat box. So it's my pleasure now to introduce our two speakers. So Candy Radaba is an occupational therapist with experience in mental health, outpatients, pediatrics, acute care, community, and private practice. She has been an instructor in the Occupational and Physical Therapist Assistant Program at Red Deer Polytech since 2013. Candy has specialized training in a variety of areas such as cognitive psychotherapy for depression and anxiety, solution-focused therapy, and motivational interviewing. Candy is a graduate of the Doctor of Science in Rehabilitation and Health Leadership program at Queen's University. Her doctoral research focused on life skills training for students in therapy assistant diploma programs. She developed and evaluated online life skills training modules on performance management, money management, and manual skills. The modules are available as an open educational resource entitled Life Skills Training Modules. This research can be applied to contexts where college students would benefit from explicit support in developing life skills. Candy is also the author of the book, Peaceful Relaxation Scripts, Group Facilitation Guide 2022, a guide for mental health practitioners and other professionals who use relaxation techniques. And we'll get to experience that later on today in our webinar. Rachel is an occupational therapist who has been teaching in the Occupational and Physical Therapist Assistant Program at Red Deer Polytech since 2017. She began her post-secondary education at the U of A, where she obtained a Bachelor of Science with specialization in Physiology and Developmental Biology in 2010. Following completion of a Bachelor of Science in Environmental Health after degree in 2012, Rachel continued on to pursue her Master's of Science in Occupational Therapy from the U of A. Her clinical work has focused in the area of neurology, specifically post-stroke rehabilitation in acute care, inpatient, and outpatient settings. She continues to work clinically and is passionate about furthering her education and teaching and learning. So please welcome Rachel and Candy. And we'll hand it over to you now.
All right. Can everybody see the slides okay there?
Yes.
Yep. Perfect. Okay, thank you so much, Shelley, for the introduction. Candy and I are very thrilled to be here to be sharing with you today. So the title of our presentation is Building Confidence and Safety, practical and cognitive behavioral strategies for managing concerns about falling.
So I'll start us off with our specific land acknowledgement related to our location here in Red Deer. So we're from Red Deer Polytechnic, and we just wanted to recognize that our campuses are located on Treaty 7 land, the traditional territory of the Blackfoot, Tsuut'ina, and Stoney Nakoda peoples, and the Central Alberta region where we serve falls under Treaty 6, traditional Métis, Cree, and Saulteaux territory. And we honor the first peoples who've lived here since time immemorial, and we give thanks for the land where RDP sits. This is where we strive to honor and transform our relationships with one another.
So to start off, we have some objectives here for you, which is kind of the outline of our plan today. We realize that there could be individuals from a variety of different backgrounds and in different roles. So we may have some who are potentially supporting those who've had a fall. We may have individuals who have had a fall and are working on getting back to activity, maybe healthcare workers, educators, and of course those in public health as well. So we strove today to have a presentation that everybody in any of those roles could take something away from. So hopefully you'll be able to pick out some components that could be useful for you regardless of what role you're in today. So we're going to start off by describing the impact that fear of falling can have on an older adult's life and talk about maladaptive thinking and behavior changes that can occur as a result of concerns about falling. We have some practical safety strategies that can help one to return to daily activities. We're going to look at some different types of equipment to improve both safety and confidence. And then we're going to look at cognitive behavioral strategies to sort of help change some of those maladaptive thinking patterns and replace them with more positive, realistic thinking patterns for those who have concerns about falling. And then lastly, we'll discuss relaxation techniques targeted at reducing anxiety. And if we have time, we will do some of those. So we'll see how far we get today. Okay, so how can fear of falling occur? So research says that fear of falling is very widespread among older adults, and older adults here are defined as those age 60 plus. So when we look globally, close to 50% of older adults have a fear of falling. So there are some risk factors that the research indicates. So if somebody is older or of increased age, they're more likely to have that fear. If they're female, living alone, if they have psychiatric illness or neurological disease, all of those factors could potentially increase the risk that the individual may be afraid of falling or have concerns related to that. So how can fear of falling occur? So we have found that often post fall, so if somebody has already had a fall, this can definitely lead to a fear of falling. In addition, different populations who are potentially not confident or have difficulty with balance, they also are more likely to have a fear of falling. Those who are more frail and those with decreased mobility as well. So impacts of fear of falling are a lot more widespread than what one might think. So we do know that older individuals who are concerned about falling see impacts in a wide variety of areas of their life. So psychological, social, and physical aspects of their life are all impacted. We also see that these individuals are not as likely to participate in their daily activities, especially those that get them out and about and get them involved in communities, etc. So social outings, group activities, family gatherings, and physical activities, individuals are much less likely to participate in if they're afraid of falling. So on this slide, we look at the impacts of fear of falling. So like I talked about before, we do see decreased participation in different activities. And here we've split them up into different categories. So physically, once somebody has a fear of falling and they've decreased their participation in activities, we often see a decline in their physical characteristics that allow them to continue to engage in all of that activity. So they may experience muscle weakness, reduced cardiovascular health, decreased muscle strength, and decreased balance as well. Psychosocially, because people are limiting their participation in different activities and they're often not getting out of the house as much, we see more social isolation. And because of that, we do see some cognitive decline and increased loneliness. Psychological impacts are increased anxiety and depression. And then when we look functionally, we see that people have more difficulty with BADLs, which are basic activities of daily living. And those include things like bathing, dressing, grooming, just taking care of yourself each day. And also with IADLs, which are instrumental activities of daily living. So things that are a little bit higher level, shopping, cooking, driving, all of those. Important to also note that there is a bit of a reciprocal relationship here too. So individuals are likely not participating in activities due to their fear of falling, but then this decreased participation in activities can also further the impacts that we see here on the screen.
So, I'd like to talk a bit now about some of the maladaptive or unhelpful thinking patterns that can occur as a result of a fall. Fear of falling actually increases the risk of falls, and there are a number of reasons for that. There are changes to attention and changes in balance that are caused by some maladaptive behavior changes that can occur due to that fear. So, walking with a wider stance, taking shorter steps, reducing head movement. Also, individuals who have a fear of falling are likely to tense up their muscles if they feel that they are about to fall. And this actually decreases the information that the body can get from the environment and it worsens balance. Anxiety alters the brain's perception of balance and it also contributes to all of these changes. In recent months, I became personally aware of the changes that can happen with thinking patterns after a fall. So, these pictures are of me. I was hiking on an easy trail that I had done many times before without an issue, and I had a bad fall where I was going down a slope. My feet slipped on some gravel while I had the dogs on a waist leash, and I fell back on my hand and broke my wrist. And so I noticed in the aftermath of that injury, some changes to my behavior as a result. My confidence had really suffered, and I noticed that I was fearful when I was walking on gravel or going down hills or slopes, even small ones, and even in situations that were unrelated to my fall, like going on stairs. I was anxious about walking outside, and even after those physical injuries had healed, I kept having fears that I would fall again. And so for quite a long time, I avoided walks on uneven terrain. And then when winter came and we had ice and snow, my nervousness was amplified when I had to walk on snow or ice. And so I'd really noticed how my thinking had changed and my behavior had as well. And these thinking and behavior changes happened even though my fall wasn't caused by any mobility issues or balance issues, and it didn't happen while doing regular day-to-day activities. And I can only imagine how much it would amplify that concern and that fear of falling if a person does have those mobility challenges and problems with balance, just how thinking could definitely change after a fall. So there are a number of strategies that can help reduce the risk of falls and help people get back to living their lives. And we'd like to focus on some equipment and practical safety measures, thinking strategies, and relaxation techniques. And I used all of these strategies myself to return to getting active. And I've now been able to resume the things that I had stopped doing after my fall. Getting active is such an important strategy, as Rachel had mentioned, because being active builds both physical and emotional skills that can help reduce fall risk and help build confidence. So the strategies we talk about here can help with getting active and resuming those valued activities.
Okay, so we have a few different pieces of equipment that could be helpful for those who have concerns about falling. The first one here, these are called hip protectors. And as you can see on the images going from left to right, we have on the left what a pair of hip protectors looks like. And then we kind of have a zoomed in image of what it actually looks like underneath the padding over top of the hip there. And then on the far right, we can actually see where that padding exists right over top of the hip joint. So these hip protectors go on just like shorts, basically. They may have to go on underneath slightly looser pants, but generally they can be worn underneath many different types of clothing. And as you can see with where the actual cushion is placed, these can help to protect the hips if a person were to fall. So if a person were to fall while wearing these, they have seen that they are less likely to actually experience a hip fracture. On the next two slides, we have a variety of different types of gait aids or walking aids. This is definitely not an exhaustive list of walking aids. And within these, there may be certain assistive devices that may be more well suited to you and the activities that you participate in, as well as your mobility levels. So in order to choose one, it could be helpful to talk to a physical therapist who can kind of walk you through that, and then they can even size you for a particular gait aid. So here are a couple. On the left, we have what's called a four-wheeled walker or rollator. So this allows patients to be a little bit more mobile when it has four wheels. And on the right, we have a walker with two wheels. So it provides a little bit more stability for patients and slightly less mobility. And each could be suitable for different persons with different levels of mobility as well as safety concerns. So those are two different options. On this slide, on the left, we have three different types of canes. So canes, I'm sure everybody's fairly familiar with, and they're usually fairly easy to obtain. So we have just sort of a simple basic cane with the two images on the left there, just with different handles. So there's lots of options. And then the third one in that image on the left has a wider base. So that's called a quad cane, and it actually provides more stability than a regular cane would. So maybe somebody's not quite ready for that single point cane yet. A quad cane could be an option for them. And then on the right, we have one more type of walker alongside that quad cane. This is a frame walker, a standard walker, we call it sometimes. As you can see, it doesn't have any wheels at all. So it is the most stable for persons who would need that stability or would benefit. Okay, when we look at this slide, we see Candy's here using some walking poles. And people often will use those for hiking or things like that. But hiking poles or walking poles, they can also be used day to day for basic walking around and doing daily activities around town. And sometimes patients prefer these because they feel that they have a bit more of an athletic style and they sort of prefer that to having a different or traditional type of gait aid. So we have on the right what's called an ice cleat. So it functions similarly to what we would put on the bottom of our shoes. So it would, it has spikes and it would give us more grip on our shoes. But these are actually specially made for hiking poles or for canes or crutches. So along with having a gait aid, if the person is having to go out in our weather that we have here, those ice cleats could be really helpful in giving them a little bit more stability overall. So there's many different options, like I said, in terms of gait aids and different equipment to supplement the use of gait aids as well and to make them safe for different environments. Again, this wasn't an exhaustive list, but it kind of gives you an introduction to a few of the main types. Here we have a few other pieces of equipment. On the left, we have micro spikes or shoe grips. They're kind of similar to crampons. that work to give more grip, and you can generally put them on the bottom of any type of shoe or boot. And then in the winter, if you're walking on a slippery or icy surface, this gives a lot more traction, so the person is not as likely to slip and they would feel a lot more confident. With these that we have pictured too, you can easily take them off and on. So if you go inside somewhere, you could take them off, and you could put them on different pairs of shoes as well. Another piece of equipment that could provide a lot more confidence is wearing a helmet while walking, especially for those that maybe have had an incident where they've fallen and they've hit their head, or maybe they have a previous concussion or something like that, and they're concerned about their safety in that regard. So we have a more athletic looking helmet there in the middle, which is an option. And then on the right, we have a helmet that actually is disguised as a hat. So you can get a few different varieties of those as well, in case people are self-conscious about maybe walking around with the helmet on. You could have it disguised as a bucket hat or a toque or something like that. So all some really good options for equipment for the patient population who's returning to activity after a fall. Okay, so where to start with return to activity? Balance and strength are really important components that reduce the risk of future falls. So it's really important for a person to get back to activity as soon as possible. We do know that with our musculature function, if you know the old saying, if you don't use it, you lose it. So if somebody has maybe had a fall or they're afraid of falling for another reason, maybe due to decreased mobility, and they stop doing their regular physical activity, they can actually get weaker fairly quickly. So focusing on return to activity, especially that balance and strength component, is really helpful. I have a few images of some exercises that provide a little bit more stability for those who are maybe just beginning to return back to activity and they really want to limit their risk of a fall. So we have some seated chair exercises. Those are easy to do, and there's lots of videos online if you search seated chair exercises. And then on the right, there's a class with balance and strength training. So there are some different options. You could do individual exercises or potentially take part in a class. And you can use different supports when you're getting started with those activities as well. So in the image here, the ladies are using a chair for support, but you can use a wall or a bar. Or there's a variety of different things that you can use for support when you're just starting to work on those types of exercises. When we're beginning back to activity, both if you're somebody maybe encouraging somebody to get back to activity and kind of guiding them, or if that is you're looking to return to activity, it's important to start small and gain some successes right off the bat. So instead of going on your maybe pre-injury or what you used to do a few years ago, big long walk, it's important to start smaller and maybe in a different environment where there's less risk involved, so the person would be more secure. So for example, if somebody used to go for walks frequently and that's the physical activity they're looking to get back to, walking indoors somewhere like in a mall or on a track could provide that sort of safer, more secure environment where we don't have interference of the elements. Doing shorter intervals of activities, that helps to eliminate or to decrease fatigue. We all kind of know that as we get fatigued, we don't feel as confident in our movements. So starting again with shorter intervals can help the person to feel more secure and have them gain some success. And then lastly, having somebody there with you to assist you. So it could be helpful to have a healthcare worker or even a friend or somebody with you. And that can help to kind of provide extra support when you're getting back to activity. If you're somebody who's looking to support an individual to return to whatever they were doing prior, it's good to slowly decrease that support over time to help that person regain their independence. So great to really provide a lot of support and sort of scaffolding off the bat and then slowly back off over time.
So, as Rachel discussed the different equipment and strategies for resuming activities, you might have been thinking about how hard it can be to overcome that anxiety and fear that can keep individuals from venturing out. The thoughts that a person has that are maladaptive can be a really big barrier because our brain's job is to keep us safe. And so, after a person experiences a fall, the brain is going to say that being active is dangerous because it could lead to another fall. And these thoughts are intended to protect us, but they're often distorted and over exaggerate the risk. Implementing behavior changes and implementing the strategies to get back to being active is not always easy. And that's where cognitive behavioral therapy can be really helpful. So, also known as CBT, cognitive behavioral therapy, is based on that idea that our thoughts, our feelings, and our behaviors all impact one another, and that if you make a change in one area, it impacts all of the other areas. The word cognitive refers to thoughts. And by modifying thoughts, we can actually change feelings and behaviors. CBT uses techniques that will actually help to change thoughts that are distorted and unrealistic to make them more adaptive, more realistic, and more helpful. An important distinction here when we're looking at changing thoughts is that CBT is not a matter of positive thinking. It's not about coming up with positive ideas and repeating them. CBT actually involves getting at the root of the negative thoughts, the maladaptive thoughts, identifying distortions that are present, and being able to make thoughts more realistic in order to lead to more adaptive behavior changes. So, as we've talked about, when a person has a fall, they have those thinking changes that are intended to keep them safe, but are actually unhelpful and can interfere with them becoming active again. And so, if we're helping a person get back to activity, we can actually help them to explore their thinking, the reasons behind the negative thoughts, and look at other alternative ways to view things. So you may or may not be trained in CBT or in a position to use this mental health intervention, but there are components of CBT that anyone can use to help modify thinking in more adaptive ways. So we'll talk about ways that you can apply strategies based on CBT, and there's strategies that anyone can use, whether you're looking at changing your own thinking patterns or you're supporting someone else to make those changes. So you don't have to be a mental health professional, and if you do get stuck, there are many supports and resources available that we will talk about. CBT is a really well-researched, proven method for improving mental health, making positive changes, changing thinking. And even if a person is referred to a mental health professional to do that work in more depth, there's still a place for support persons to reinforce realistic thinking and to support the person in working through those small steps in the right direction as they get back to being active. So, distorted thoughts aren't realistic. The distorted thoughts that a person can have after a fall can lead to changes like isolation, withdrawing, being less active overall, and even stopping valued activities altogether. All of these changes, as we've discussed, can lead to deconditioning and can actually increase fall risk, in addition to reducing quality of life. So it is really important to change those thoughts because they have such a huge impact on the person overall. So there are a couple of things that are important to do. One is to support the person to overcome maladaptive thinking as they work through small steps, breaking things down to do those easier things first and work up to more and more activity. And through the process, reinforce success, providing support and encouragement. There's a tip from Ian Holbrook in his 2024 presentation that we've referenced here in our slides. And he suggests that we avoid using the word fear when we're working on supporting someone, because this word puts the focus on feeling afraid. And what we want to focus on is building confidence and success. So instead of saying things like fear of falling, it can be helpful to use a little bit more neutral language like concern about falling and focus more on the success side and reinforcing that. So avoid using that word fear if you can, just to keep the focus off of being afraid. So let's look at some common thoughts that can be related to concerns about falling and questions that we can use for helping to explore thought patterns. Pretty commonly, if someone has had a fall, they'll think things like, I can't go out because I'll fall, or I can't do that activity. If I do that, I'm going to fall. They might even have thoughts that interfere with using some of the strategies like safety equipment. So they might say things like, I'll look old, or people will stare at me if I use a cane. And so these thoughts are all maladaptive. More realistic thoughts can eliminate the barriers to being active and can help to build confidence. So, as I've mentioned, CBT doesn't involve just some positive affirmations that we repeat. We're actually looking at helping someone to change their beliefs to think in more rational, more adaptive ways. So, the presentation referenced here by Ian Holbrook has some really excellent information about preventing falls, and inspired these questions. And in his presentation, he goes through some really great ideas for how to ask questions. Um, as tempting as might be to tell the person that, oh, no, no, that's not true, you're not going to fall, or, otherwise tell them that their concerns are wrong or that they're not realistic, it's more important to actually ask them about their thoughts so that the individual can explore what they're thinking and look at if there might be a more realistic way to see the situation. If we just tell the person what to think, it's not going to change their thoughts. Um, so we want to ask open questions about what the person is thinking. So what do they anticipate about things they want to do? For example, you might ask them how successful they think they might be in accomplishing that next step toward becoming active. If you're working on changing your thinking or you're supporting someone to change their thoughts, there's a list of questions here that can be helpful to explore those thinking patterns. So, for example, if someone says, "I'll fall if I leave the house," maybe you could ask them, "How sure are you that you'll fall if you leave the house?" On a scale of 1 being no chance of falling to 10 being definitely I will fall, because that can give you such a better idea of where the person is at, and it can also help them to see. How realistic their thought is, because the thought comes, the thought is, if I leave the house I'll fall, and when the person explores it and says, well, how sure am I that that will happen, then they can see, okay, maybe I'm at a 5, I'm right in the middle, I think I could fall, I'm not certain I could fall. So exploring it in that way with those open questions is really helpful, and this can actually assist us in breaking things down into small achievable steps, because if you ask questions about how the person anticipates whether they'll be successful at each step, you can determine maybe that step is too much. Maybe we need to scale it back. So if you ask the person, how successful do you think you'll be in walking to the mailbox? And they say, not very successful. I think I'd be a 2 out of 10. And maybe you break it down and say, okay, well, how successful might you be if you walk to the mailbox while using micro spikes on your shoes and some hiking poles? And then you can evaluate where they're at and look at breaking things down to be achievable. So there are a number of more adaptive thoughts that a person might come up with to help them as they are looking at being active. So things like, I can go out with equipment to stay safe, or I have safety measures in place to leave the house safely. I feel better when I go out. No one will think using this cane is unusual. And those are all great examples. And again, we don't want to tell the person what to think because it just doesn't work. So if the person says, people are going to stare at me if I use that, or I'll fall if I do that, and we just say the opposite, we haven't convinced them. We're just kind of making them feel a bit alienated. And so don't just tell them, nobody's going to stare at you, or no, you're not going to fall, you'll be fine. Instead, use those open questions to explore the thoughts that the person has related to doing activities. Um, so as you use those questions, the person can help to challenge thoughts that are less realistic and even modify their behaviors to give a greater likelihood of success and more confidence that they'll be successful. And so doing those easier tasks first, build confidence, and that also helps to change thinking to be more adaptive as we experience success. So overall, this process of applying these CBT-inspired strategies to help change thinking, it involves supporting realistic thinking patterns and exploring thinking patterns to help challenge the maladaptive thoughts. So whether it's for yourself or for someone you're supporting, it's important to reinforce realistic thoughts, as this is our objective. We want to help the individual to more habitually think in realistic ways instead of those distorted ways that happen because the brain is saying activities are dangerous to try to keep the individual safe. So as you're going through these small steps toward returning to activity, keep supporting the person to build confidence, use the practical safety strategies and those open questions to explore and change maladaptive thinking. You'll be having these conversations anyway if you're supporting someone who's considering going out or considering becoming more active, and you can help reinforce realistic thinking instead of the maladaptive thinking. And that support and encouragement along the way are so important to help create more realistic thought patterns. And sometimes this process of identifying distorted thinking and challenging it, asking how realistic it is, seeing if there might be different ways to look at the situation. Sometimes this can help the person change those distorted thoughts and think in more accurate and rational ways. And other times the process of changing thinking can be more difficult. And so if kind of exploring thoughts, rehearsing the more realistic thoughts isn't working, even with all of these strategies in place, that's really normal. And changing thinking can be hard. It doesn't mean that you're doing anything wrong. So if you're finding that there are some really stubborn maladaptive thoughts, just know that, that's normal. The brain is trying to keep the individual safe and seeing activity as a potential threat. And this is where specific and targeted CBT techniques can come in. So the things that we're talking about here just touch the surface of what CBT has to offer. And to go deeper, it can be so helpful to work on CBT strategies with a professional who can help guide you through the process of changing thinking. So working with a mental health therapist, an occupational therapist, or another professional who does CBT can be immensely helpful. We highly recommend it. And you can also do CBT on your own. CBT through self-help is also well researched and proven to be highly effective. Self-help resources like the book When Panic Attacks by David Burns can help motivated people to work through CBT exercises independently. So just remember that it can be challenging to change your thinking, and if you get stuck, that support can be immensely helpful, and there are a variety of supports available. So repetition is key. Keep rehearsing realistic thoughts, and it can be helpful to repeat calming self-talk before, during, and after engaging in activity with those safety measures in place. And just as an example from myself, as I was working toward being active again after breaking my wrist, I used small steps with safety precautions in place so that I could progress safely and feel more confident. So I started out with flat terrain, no obstacles, no gravel, no hills, and just shorter distances. And I worked up to longer distances, and I used safety measures like a splint that I wore to support my wrist, hiking poles, micro spikes, all of those things to help me stay safe. Another thing that I did was used relaxation techniques to help reduce that anxiety that can come up, because it's really normal to have anxiety when working through getting active again. And so in that process of returning to activity, relaxation can be very helpful to reduce anxiety and to reinforce calm thinking patterns. So, relaxation is basically a natural physiological process where our bodies return to a state of equilibrium and calm by activating the parasympathetic nervous system. And this is the opposite of fight or flight. So, relaxation is something that our bodies can do automatically. And it's also a skill that can be learned, where you can actually learn the skill of doing relaxation, activating that parasympathetic nervous system on purpose. So, relaxation techniques are associated with many benefits like reduced heart rate and blood pressure, less muscle tension, lowered stress hormones, a general state of well being and calm. And regular use of relaxation techniques can improve physical and mental health. Relaxation scripts are written directions for relaxing and being able to purposely facilitate that relaxation response. And guided relaxation can be a really great way to start. You can listen to recorded relaxation audio. You can even record your own audio to guide you through a relaxation exercise. So there are a couple of ways to use relaxation techniques to help enhance success when returning to activity. One is to regularly practice a full relaxation exercise. So aim for 15 to 30 minutes with things like calm breathing, muscle relaxation, calming thoughts. And this can actually help us to modify thought patterns by rehearsing calming thoughts and calm self-talk while in a calm state. And so I've included here a link to both a written relaxation script and an audio recording that specifically target reducing anxiety related to fear of falls. And any relaxation can be helpful. It doesn't necessarily have to specifically be focused on falls. Just that act of practicing relaxation can be very helpful. So doing that on a regular basis builds that skill of learning to activate the parasympathetic nervous system. Now, the second way that can be really helpful to use relaxation is in the moment when doing activities, when thinking about doing an activity, or when anxiety arises related to that concern of falling. To use relaxation techniques in the moment, it can be as simple as a deliberate pause and taking some time to breathe. Purposely relaxing the tense muscles. As you'll recall, the muscle tension that a person can experience when they anticipate falling actually makes the person more likely to fall. So specifically focusing on letting some of that tension go and then moving forward can help to keep the person safer. And so if nothing else, just breathe, just taking that moment to focus and breathe. So you can do that for yourself as a support person. You can remind someone that you're supporting to use relaxation in the moment to help become more calm. So overall, relaxation can be really helpful to reduce that anxiety and help a person be safer. So just as an example, we'll take just a minute or two to do a quick relaxation technique so that you can see what sort of things you might do to help in the moment. So if you take a moment to set aside any distractions, so just put those things aside for a moment and just be present to take a brief moment to relax. If you'd like to close your eyes, you can, or just focus your gaze on one spot. And then just take a moment to breathe. So purposely exhale and let that air out. And then just at your own pace, take a slow breath in and then pause for a moment before you release the air. You can even count if you want to. So you could breathe into the count of 5 and then hold for a count of 2 and breathe out for a count of 7. And then just keep breathing at a nice slow pace and purposely relax any muscles that are tense. So let your shoulders relax, just let them drop down a little bit, letting go of some of that tension in your shoulders, letting them be loose. Relax your neck. And then sit tall with a good posture that opens up your chest and lets you breathe. And then just repeat some calming self-talk. So I'm okay. I'm safe. I take measures to stay safe. I'm safe being active. I walk safely. Good. And then we can just come back, bring your attention back here, and we'll end that quick relaxation. So just a brief break like that can be a helpful way to reduce anxiety in the moment and make a person less at risk of falls as they attempt different activities. So this can really reduce anxiety in the moment and help a person be active more safely and more calmly. So you can use relaxation on a regular basis to train that skill to relax, and you can use those quick techniques in the moment to help take away anxiety and promote safety.
Okay, so to conclude, we'll just summarize a few of the things that we went through. So we realize again, you may be supporting individuals who are looking at returning to activity post fall, or this may apply to you. Maybe you're looking at getting back to activity. So encourage exploration of the person's own beliefs, right? Instead of just telling them how to think, we're going to encourage them to explore their own beliefs. And remember that if you are the individual looking to do that, that you can do that on your own with some resources that Candy had mentioned. Um, the other thing that you can do is look for different equipment options that can assist somebody in returning to activity safely. So not only can it help them be safer once they do start being active again, but it can also help improve their confidence if they have some safety equipment. And again, presenting options and figuring out what is most suitable for the patient and what options they would like to try is really important, instead of just directing what they should be using. Assisting the individual in returning to activities by looking at exactly what they're participating in. So breaking things down into small chunks that they could be successful in, and working on that balance and strength training is really important. Slowly increasing activity level and the difficulty of the activity, and then slowly increasing the person's independence. So if you're that support person, you're slowly taking a step back as the person sort of continues to improve. Using these relaxation techniques, again, like Candy said, even something that's quick, and it doesn't have to take too long. It can be really helpful, but then also providing extra resources if the person would like to continue to work on engaging that parasympathetic nervous system so that it's easier for them to access during higher times of anxiety can be great as well. And then ultimately, there's lots of supports available. So again, we realize that there may be a variety of roles here. You may be a different healthcare worker that isn't an OT, a PT, or a mental health professional. And those are generally the persons who would sort of specialize in these topic areas that we covered today. So if you're needing more support, if what we've gone through today doesn't seem to be helping the individual and they feel like they're a little bit stuck, or you feel like you've exhausted all your options, connecting the person with supports as needed, or if you are that individual, reaching out to supports. Occupational therapists, physical therapists, and a variety of different mental health professionals can be so helpful in getting your confidence back and returning back to activity. Thank you so much for having us today. We really appreciate everything and being able to come and present to you. And we're happy to take questions now if anybody has questions.
Okay, that was great, you guys. So yeah, thanks to Rachel and Candy for their presentation on building confidence and safety with practical tips and CBT strategies for managing concerns of falling. You've given us some really great um, tips and practical strategies to help overcome this maladaptive thinking and kind of those patterns of distorted thoughts, as well as beliefs and behaviors to support people in success with their concern moving forward with their concern of falling and return to activity and thereby increasing quality of life. So that's just great. Appreciate all the information. I think that gives people lots to think about and some resources to follow up on as well if they would like to learn more information. I think that David Burns' book will be helpful as well as just changing the language to concern and breaking things down into steps and thinking about various kind of aids and a good gamut of approaches that the relaxation techniques that can be used. So yeah, so let's pop over into our question and answer and see if we have any questions there or any questions that have popped up in the chat box. And I'm not seeing anything. People are clearly contemplating, I'm sure, thinking about all these learnings today and how that applies to the work that they're doing in supporting older adults on this issue, um, or as it may come up as an issue. And, they may be in position. I think some of those questions that help people to um, explore their maladaptive thoughts, I think are really helpful to pose. Is there more questions that people could access, like from, just like a layman's terms? Um, would they be in that David Burns books? Is there other kind of resources that might give people some more
Mhm.
approaches
Yeah.
on that?
Yeah, I would suggest a couple of places to look for those types of questions. The David Burns book that I recommended called When Panic Attacks is really great. It's specific to anxiety and it helps to actually walk through a sequential process of working on examining thoughts. So that's a great resource. And David Burns has a number of really good books. I think probably his oldest and most well-known book is called Feeling Good. That's another good one. I also recommend the presentation by Ian Holbrook, and he talks about some specific questions and goes through some examples of ways to use those questions. So that's a really great resource as well. And I think sometimes people put pressure on themselves and they think, I have to say the exact right thing, or I have to come up with the exact right question. And you don't. Even sometimes just saying, like, how sure are you about that? Is is a really good question that gets the person thinking, and that's a good place to start.
Yeah. So those, yeah, kind of simple, open-ended, short questions.
Yeah,
Yeah. Yeah.
yeah.
Yeah. How many people out there are or have worked with older adults that have had a fall and they've seen the results of that fall with this um, fear of falling? Um, I see we have a comment in the chat box. Just thank you for your presentation. I'm a physiotherapist and found the information you provided very helpful. You have given me some helpful strategies to use with my clients. And that's from Lori McLeod. And Nani Arthur, great presentation. Thank you for your time, some valuable suggestions and ideas. And Caitlin says, yes, lots of experience. I find education is very helpful for them to reduce fear. Um, What is another question in the Q&A here? What is the success rate of CBT in clients with dementia? I don't know if there's
Mm.
been a lot of research
I'm
done.
not aware of any. I don't know. I don't
Mhm.
know if Rachel, if you've heard of any research. So I have not come across any about CBT with people with dementia. I do suspect that it depends on the severity of the dementia, and it's
Yeah.
probably still helpful to a degree if the person is able to converse. It
Mhm.
it doesn't necessarily require you to remember later what was discussed to help in the moment. So even if the person has some cognitive difficulty, I know that there is research about using CBT with people who have other conditions like psychosis, and it's proven helpful there. So I think there's a likelihood that it's helpful, but I'm not aware of actual evidence one way or another.
Yeah, I would second that. I don't know about evidence, but just to kind of follow up on what Candy said, it's not always necessarily about being able to verbalize everything or remember, but with a different actually CBT workbook that I've seen, it actually has you go through and rate sort of your level of anxiety surrounding a situation with one belief before you've explored your thoughts, and then once you've explored your thoughts and you've come up with a more adaptive thought pattern, you actually rate how you're feeling again in your body. And typically, the anxiety level always goes down and the comfort increases. So even I feel like having somebody with dementia experience that comfort and that change in their body and how they're feeling after exploring those thoughts, if they're capable of actually doing that, I think it could still be beneficial. Sorry, we don't have the exact research, but I do think with experience, if they're able to participate, it could still be very helpful.
Mhm. I've added to the chat the reference and link for the Holbrook presentation that we recommended. So there is a YouTube video there, and there are some other presentations that are also really excellent. So I definitely recommend that.
Yeah, it's worth watching for sure.
Mhm.
Yeah. So we had another comment about I like the strategy about not using the term fear,
Mhm.
more around that neutral language with that concern and that was Hallbrook brought that to attention from some work that he'd done. I think it was in Australia. That seniors had expressed that they did, that the language needed to change in order to, kind of better engage about this topic. So, um, and we have Sky, who says works as a kinesiologist leading a fall prevention program in ON for seniors. I touch on fear of falling in the introduction of the program, and it helps illustrate how falling is not a normal part of aging and can often be prevented or a management situation. I will be adding CBT into my health talk about stress management, so that's good. If
Mhm.
people did want to get CBT training, where would they find that?
There are a number of workshops that people can do either in person or online. Um, yeah, if you're able to find a David Burns workshop, they are wonderful, but he's not the only one who does training in CBT.
Any last questions or comments? We've got another minute maybe for that. Just had some more thank yous for the informative presentation. And the training's, excellent, but like, you've alluded to, you don't need to have that formal training. It's really about that kind of open-ended exploration kind of question and conversation and kind of breaking things down into steps with people and just, really having that conversation is a big start
Mhm. Yeah.
because it's often not acknowledged, like not recognized. So
Mhm.
even that in itself,
Mhm.
can lead to the next step, just to have that
Yeah.
conversation about,
Mhm. Yeah, even just normalizing that it is normal to have anxiety about falling after
yeah.
you've had a fall. It's your brain is trying to keep you safe, and it doesn't mean that you are going to fall just because you have that feeling.
Yeah, exactly. And this is for all age groups.
Yeah.
There's
Mhm.
anxiety for everybody
Yeah.
after a fall for sure. So, okay. All right. Well, if there isn't any more questions or comments, I just want to thank you all for joining us today and refer people to the Finding Balance website because there is a number of exercise and other benefits of physical activity resources available. We have like strength and balance exercises and seated chair exercises there. So, and an exercise poster. So do check that out for download or order from our website. And I think Marla is now posting the survey in the chat. So that'll be available when you close out of the Zoom window and also sent to you by email. So please take a few minutes to complete that survey. And Marla is adding that. Well, you've got that YouTube link with Hallbrack to the chat. Um, we also recommend people sign up to our Finding Balance Bulletin newsletter, and we'll be posting some links to this in that April newsletter as well as on our Finding Balance website. So you'll be able to access the recording again if you want to. It always helps to hear it a second time. It's always lots of great information, but to process. So. Um, I think I'm just double checking that I haven't missed anything else, and I think that is everything. So thank you both, Candy and Rachel. Just really appreciate all your time and effort put into building this presentation for us and presenting to us today on this excellent information. Thank you all.
Thank you.
Thanks.